All right, so the topic of today's workshop is when coaching meets therapy. I'm really excited about this workshop. I think it's my first time to address this to a team of coaches, and I'm really honored and proud to be here and to be talking to you about this topic. So what I have in mind for the agenda, first of all, I always like to start my workshops with a little, run through the basics of how we're gonna spend this hour together. And then I'm going to take you through the mental health landscape, which Ashraf, if any of you were in the talk yesterday, kind of touched on. So I want to kind of touch on that a bit more, talk a bit more about the mental health landscape at large. And then we'll talk about when to refer and then how to refer. So those are the two kind of things that I'm hoping that we'll get out of this. Okay? So the basics, as I said, this is a workshop, not a talk, which means that it's collaborative. So I'm hoping that you guys will get to engage with this. We only have an hour, so I'm not gonna break us off into groups and do things like do practice runs, even though I would have loved to. But I would like for you guys to kind of engage with me, interrupt me with questions, interrupt me with your opinions. This is a dialogue. Over the past, day and a half, I've learned so much about the different types of coaching. I've learned so much about the different schools and the different mentalities that people have when they approach this. I understand that referring is really not easy, and people have different opinions of how to do it, whether they should do it, when they should do it. So as much as I would love to impart my knowledge, I also want to learn from you. I also want you to learn from each other. So let's keep it as a dialogue. So that's kind of what I'm thinking about in terms of the setup today. It is a process, so you're not going to leave this workshop with now I'm ready to be an expert referral. You will begin this process of figuring out how you will be referring and what makes sense to you and how you will interact with your clients, because your relationship with your clients is unique to you and your clients, right? I always talk about these two concepts of education and personal responsibility. Education, well, first of all, personal responsibility is this kind of concept of, being in the driver's seat, and this is something just by choosing to come to this workshop, you are sort of practicing this personal responsibility to educate yourself about something that maybe you've thought about, maybe you haven't. So just, things to keep in mind. Again, it's only 1 hour, so if you don't get a massive amount out of this, but if you get one thing and that's maybe a slight change in your perspective, I'll have done my job. I'll be happy with that. Okay. All right, so our objectives. First, what we want to do, we want to gain a better understanding of the mental health landscape. We want to recognize when you might need to refer a client, and that's not always easy. Sometimes it seems very obvious, and sometimes it's really, really blurred, right? And then also to understand what tools are at our disposal, because once you recognize that you need to refer, it doesn't mean that that's the easy part. and that's not easy. Recognizing isn't easy, but then once you recognize it, what do I do? How do I do it? It can be really difficult, and I want to touch on some of those difficulties. Even in my own practice, I experience that all the time, where I have to refer out, and there's so many kind of negative feelings that might come up for me personally, and I want to address those with you. All right, let's talk about the mental health landscape. So I apologize for some of you, this might be a repetition of things that you saw yesterday, but first we want to understand the breadth of the problem. There are over 200 mental illnesses out there, okay? That's quite a number. Taban, this number, there's so much overlap with them. Generally, I don't worry too much about diagnosing. For a lot of people, it can be really helpful. Especially maybe sometimes you'll have someone who will come to you and say, I have XYZ. I have been already diagnosed with XYZ, and that might be something that you kind of have to keep in mind. I think yesterday, before Ashraf's talk, our MC was talking about you might be working with clients who are neurodivergent. What does that mean for you? You might have to modify your practice. So just thinking about the fact that there are so many different diagnoses, and there are over 200 mental health interventions, and you lie on that spectrum, and psychotherapy and so many different forms of psychotherapy lie on that spectrum. So it's really difficult for people to figure out what they need, right? That's kind of the point of this slide, is it's telling you that it's first of all, it's hard for us to figure out what's wrong or what's happening, what I'm going through, what are my challenges. And then once I figure that out, what do I do with it? It's really complicated. It's hard for us, it's hard for our clients. It's, you know, and our role often is helping people navigate that. You know, I remember when I this is quite unfortunate, but when I worked I used to train at McGill, and in the hospital center there, I used to tell people, you know, once you knock on the door, that's it, خلاص, you're in good hands, because you may not have knocked on the right door, but you just knocked on a door, and then once you get into that room, we'll figure out which room you actually need to be in, but just knock on a door. Unfortunately, I find that, you know, in Egypt or in the Middle East at large, that's not the experience that clients have. They have this experience where they really do have to knock on so many doors before they find the right care. And that's because we're not organized, because we don't collaborate, because we don't, you know, create this system where just knock on a door and then I'll take care of you. I'll help you figure it out. I'll help you navigate it. You'll still be driving, you know, but I'll help you navigate. That's my role, to support you in this. So when we look at the spectrum of mental health intervention, and then this slide is repeated as well, we look at prevention, treatment, and maintenance across these groups. Okay, so as you move down this spectrum, this is like you get more sort of severe. So the general public, you want to do prevention, you want to practice prevention. People who are at risk, we want to identify people who are at risk. We also want to practice prevention. Early intervention is so important. It really, really makes a difference. The earlier people get help, the better their outcomes are. So that's something just really to think about, because often I think you guys might be catching people at that early intervention stage. So just something to think about. And then standard treatment, and then maintenance, and then this idea of mental health promotion. Everyone needs mental health promotion. So when we look at the full landscape, divided it again, so I'm looking at it through my lens. I have clinical, subclinical over here, and it's not that they get more or less severe, it's just kind of like a cluster of things on each side. So you have, under the subclinical, coaching exists there, along with a lot of other things that kind of coexist. And then under clinical, you have all of these other things like group therapy, individual therapy, medication, specialized programming, and people often, you know, you can understand, there's so many things that there's 200 of them, right? So there's so many things I haven't listed here. But just if you think about this full spectrum, the thing that I really want to impress upon you today is the idea that most of the time, people need more than one of these things. So it's not that you're going to get someone and you're going to say, this is exactly where you belong on that spectrum. You're here. You're one-on-one therapy. You're coaching. You are medication. No. No. Often people need more than one thing. And that's really something that I want to kind of impress upon. Like, I really want to highlight that. I want to say that over and over, is that, you know, in my job, I want to be referring people to things really all across that spectrum, because I'm not going to be everything to everyone. I'm not going to be everything to anyone, and neither will you, right? In this lifespan of a person, when they're born till the day they die, there's going to be so many things that will touch their life. You will be one of them. A therapist may be one of them. A stranger that they meet في النادي might be one of them. Their child might be one of them. An experience like camping in the desert might be one of them. There are so many things that help us on our road to recovery, and often I think we put this burden on ourselves as kind of caretakers, as people who service others. We put this burden on ourselves that I really need to give everything that I can to help this person, and yes, that's great. You should give everything that you possibly can to help this person, but you should also remember that their well-being, their road to recovery is much bigger than you, and it's much bigger than me. and there's going to be so many things that will impact them, and it can be anything along there, and it will probably be multiple things along there. And the most thing I want to say about this workshop in particular is that when you decide that maybe I need to refer, it doesn't mean that you have to give up your client. It just means that right now you're giving them something else plus you. So we'll talk about that quite a bit. I put this slide in just for reference because it's confusing. What is a psychologist, what is a psychiatrist, what is a psychotherapist, and then inside each one there's so many different things. So I just wanted to explain this really briefly, just for your knowledge. Okay, so these are the 3 Ps. You have a psychotherapist is anyone who practices therapy, talk therapy. Anybody who practices, who's licensed and trained and been supervised to practice talk therapy is a psychotherapist. A social worker can be a talk therapist, a psychotherapist. A occupational therapist can be a psychotherapist. A clinical nurse can be a psychotherapist. Also, a psychologist and a psychiatrist can be a talk therapist, okay? So a psychotherapist is anyone who has been trained to practice talk therapy. A psychologist doesn't necessarily have to be a psychotherapist, just to make things confusing. But a psychologist is someone who has a degree in psychology, which means that they could be a psychotherapist, but they could also be a researcher. So you can have psychologists who are just researchers. They actually haven't had training in clinical work, like talk therapy, okay? And then a psychiatrist is someone who's been to medical school and then did 5 years after that of psychiatry. It's a really long road. So there are people who prescribe medication. That's the simplest way to think of it, but they also have a different model about how they think about people. They think about people from a biological perspective. They think about illness. They think about mental illness and the brain and the body and what's kind of going wrong. Is there inflammation? Is there circuitry? Is there all this kind of stuff? So even when they're practicing psychotherapy, they practice it with that lens. Whereas a psychologist tends not to. They tend to think more about the social, the environmental, the upbringing, all of that kind of stuff. Okay, so that's just the difference between these 3 things. Any questions about this? Any questions about anything I've said so far?
Difference between psychologist and psychotherapist. It's not for me. I don't see the difference.
Okay, so the question is, what's the fundamental difference between a psychotherapist and a psychologist? There isn't necessarily a difference. So a lot of psychologists are psychotherapists, but some psychologists aren't psychotherapists because they just do research. They don't know how to do talk therapy. They weren't trained in talk therapy. Yeah. Oh, how do you know? Ask them. Check their licensure. What's your licensing? What was your training? Check their degrees. That's generally how. Yeah. I can actually make this a little bit simpler. I did. Thank you. So psychologists who practice therapy tend to be under 2 umbrellas: clinical psychologists or counseling psychologists. Okay, so if they have the title of clinical psychologist or a counseling psychologist, then they practice psychotherapy. There's others who do, but generally, it's a good rule of thumb. A clinical psychologist is someone who has more years of training and works more with clinical populations, and a counseling psychologist works more with someone who is going through like a life change, or that's generally the distinction. So a clinical psychologist will have trained in a hospital. They work with people with a diagnosed mental illness. A counseling psychologist works more with people who are kind of maybe going through a stressful life event, who are dealing with things like depression or anxiety, which are considered maybe, or like a milder version of that. That's generally the case. But I will say in Egypt, there are counseling psychologists who have really good clinical experience, and they're very, very they're very, like, they really know what they're doing. They're very skilled, that's the word. So, yeah, I mean, it does make it difficult when you're kind of trying to navigate and understand who this person is. I think that's in part why we're establishing this collaboration, because we'd like to help you with that. So we've done a lot of the vetting. We have a network of 150 therapists who we have vetted ourselves, made sure that they have the correct credentials, the correct experience. If ever you don't know, ask. That's what I would recommend. And I'll get into that a bit later. All right. When do I refer? Okay. So here are some signs that you might need to consider referring. And I know that the ICF, Kariman is kind enough to share with me the chapter that exists that kind of explains when you're supposed to refer. So I wanted to just kind of touch on some of these things. And as well, I want to just get you thinking about this, but also like let me know, challenge some of this, or tell me if there's something that I missed. Yeah.
There is a very clear red flag. Someone tells me they're having suicidal thoughts.
Oh yeah, that's for sure. That's a no-brainer. That's a no-brainer. Yes. Okay.
No matter what, even if I'm not 100% sure that they mean it, I would still
Definitely.
take that into the atmosphere.
Yeah. I have my next slides go talk about red flags, and I'll talk about the range of red flags, and that's on the highest end of the range of red flags. So if anyone is even thinking about suicide and you don't really think that they will do it, which might be the case, but don't risk it. It's a person's life. Don't risk it. Yeah. So if you have reasonable doubt that this person may be suicidal, refer them to therapy. If I was speaking to counseling psychologists, I would tell them refer to a psychiatrist. So this is not because I'm speaking to coaches. This is because this is a person's life, right? And even a psychiatrist, if they're for whatever reason unable to handle the case, I'd say refer. You know, we don't risk it. This is so much bigger than us. Okay, so I will get back to red flags, but thank you so much for bringing that up. All right, so signs you might need to consider referring. There's a persistent deviation from wellness, and I want to talk about that in the next slide a bit more, what that means. But note the word persistent here. There is a consistent feeling of overwhelm or exhaustion. So the client constantly feels overwhelmed, constantly feels exhausted. Note the word constant here. Feelings of depression or disinterest, or feelings of anxiety. This is kind of where we're talking about something that may be diagnosable. And this is, I think, maybe a little controversial because you're going to see people who are stressed out, right? Of course. But if it's something where you're wondering if this may be anxiety, consider referring. And I want to also just address slightly the elephant in the room. There has been obviously this long-standing kind of difficulty between therapists and coaches because we've never really worked on how to work together, yeah? And so I remember, and I want to tell you this story in full transparency. I remember when I first moved back to Egypt, I had a client come to me, and he had been seeing a coach for a couple of years, and when I saw him, I immediately recognized that what he had or what he was experiencing was health anxiety, and I practiced CBT with him because that's my specialty, and health anxiety is something that I'm very comfortable with. And health anxiety is something that in the literature takes 6 sessions, and lo and behold, in 6 sessions, he was much better. He wasn't completely transformed. I still had a lot of work to do, but it took me 6 sessions because I've been in training for 8 years, 10 actually. 10 years, and I'm still kind of in training. So there's no, and this person still sees his coach because his coach is really helpful for him. But his coach just isn't equipped to handle health anxiety, something that I was trained to do. Do you see what I mean? Yeah, for sure. And that's something, again, that I really want to say is that, just because you refer doesn't mean that you're giving up your client. It just means that you need to add something to what you're doing. So don't think about it as you're swapping yourself out for someone else. Maybe you're adding to you. Maybe you're taking a little break and then you're putting yourself back, you're gonna be back, right? And for this client, like when he came to me, his coach had been working with him on different techniques and grounding, and to be honest, I'll be perfectly frank, like I don't know how, I don't know where the coach, I don't know much about the coach. I just know that you know, in 2 years, there wasn't this referral done. And there is no reason why we can't work together. There is no reason why he can't continue to see his coach. But there was a reason why he needed to come to therapy, because he has health anxiety and he needed CBT. So, yes. Yes. To be honest, I don't know. I don't know about like if the rules for ICF or how it works for coaches in terms of being able, there's someone shaking their head, so I'm assuming that's a no. But I will say that anyone can learn CBT, but practicing CBT in a clinical setting isn't the same as practicing CBT. So I think that's a bit of the distinction, and that's what with these two lines, the feelings of depression, anxiety, I'm kind of touching on people who have something that might be diagnosable, right? So when you feel that this might be bigger than stress, this is anxiety, and this may be a form of anxiety, then CBT, the way that you would learn CBT or even DBT, you can use CBT and it will be very helpful for you. And a lot of people practice CBT even on themselves. It's open. You can go on Coursera and you can take a course on CBT. You can go to the Beck Institute and take like a full training. But you may not be equipped to understand psychopathology, which is just slightly different, right? So I don't know, does that make sense? Does that, yeah? Okay, all right. Next, they are going through a difficult life change, their relationships are rocky, or you feel there's like stagnation. Okay, so what do I mean here? I want to impress on you this idea of they're going through a difficult life change, because a stressful life event, a major stressful life event, if you're seeing a client and then they suddenly experience a really big loss, or they're going through a divorce, which is a loss, or they experience a trauma, it's best to refer. It doesn't, again, you can still keep your client, you can still see your client, but it might be best to make sure that they're also being supported by someone who can handle the stressful life event. It protects you and it protects them. If their relationships are rocky, so if you're working with a client and you notice that more and more they have this unstable pattern of relationships, there's so much conflict, there's a lot of challenge there. Relationships, when they're rocky, it's a sign of psychopathology. There might be something deeper, there may be personality disorder in there, there might be something that, again, is really hard to deal with. Even for most therapists, relationship challenges, not every therapist can handle them, right? So it's really something that looks really casual because most people have challenges in their relationships, but I'm talking about like persistent, there's always these kind of on and off relationships, there's always this rockiness, it's always kind of inflamed relationships. That's a sign that, okay, maybe, you know what, let's add someone on here that can handle the interpersonal area. Yeah. Okay.
So I will take this conversation to coaching supervision because there's something going on.
Yeah.
But from an ethical point of view, how do you look at that?
Thank you so much for that. Okay, so for those who didn't hear, the question was, so she had an experience where she referred a client out, the client chose a different therapist, and then came back and said, I'm not comfortable with the therapist, I would like to continue working with you. And so there's a challenge there of like, ethically, what do I do, and how do I move from here? And I think that's really kind of the core of it, right? If anything, maybe that's one of the things to talk about in this workshop. What do you do because you've built this relationship with your client, and your client's comfortable with you. And this, honestly, this happens to me all the time, where I've been working with a client for some time, and then I reach a glass ceiling, and I'm only looking at it from one perspective, and I know that seeing someone else would be helpful. Or I'm a CBT therapist, and I really feel you need psychodynamic right now because there's things I'm just not equipped to handle. But I'm also like, but you're my client, and we have this relationship, and they feel the same way. So again, I think that idea that you can continue to see them and refer. I think I have some, like, I'm gonna kind of talk about this a bit more, especially like in terms of what you might be feeling, and then how do you handle this with your clients. So those are the two things I wanna speak to, what you might feel, and then what your client is kind of telling you that, you know, I've tried this, I don't like it, I don't want to continue, and you're feeling like, but this is what, I really recommend this. So, yeah. 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 Okay. Okay. Yes. Yeah. He felt worse. Yeah. Okay. 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 Yeah. Yes. Tools. Yes. Okay. Yes. Okay. I'm gonna put a pin in this. I'm gonna finish the flags, and then I'm gonna come back to this because that's the meat of it. So I don't want to spend too much time on the flags. All right. Stagnation is something that kind of you just touched on. You finished all your tools and you really can't move the person anymore. You're not sure what to do next. That's a sign that maybe there's something that you're not picking up on. Okay. Yes. Can everyone hear over there? Yeah. Yes. Yeah. Right. Right. Okay. So there's the first question. Sorry? 5 minutes. Really?
What?
There's only 5 minutes left? I'm supposed to have an hour. I have so much more to say.
Keep going, Tamara. Keep going. Okay. We want to listen.
Okay.
We want to listen.
Okay. All right. Maybe I'll answer those questions then at the end, okay? Just to make sure I get through all my content. All right. So it was the first question, just to make a mental note, about like the quote-unquote non-scientific methods, and then how do you measure persistence or consistent. Important thing, which I talk about in this slide here, you have to have a baseline, and you're talking about deviations from the norm. So if a person is kind of, their baseline is a certain way, and then they change, that's when you start to think about, okay, this is something that might be a problem, and then how long does that last for? Generally, I would say if you're looking at like a month, then that's pretty consistent and persistent. You can also just kind of gauge, is this a problem? Is this something that's preventing him or her from functioning? Is this something that people are commenting about? Is this something that's really causing the person distress? Those are really important things that tell you, okay, this is persistent or this is consistent. So for example, depression, like in order to meet criteria for depression, you have to have experienced persistent feelings of low mood for most of the day, nearly every day, for a minimum of 2 weeks. So that's a way to think about it. So it's like a minimum of 2 weeks, but for most people it will be longer than that. Sometimes you may not notice it. You're also probably seeing your client only once a week, so it's hard to tell, right? So it's normal that it might take longer than that. If in doubt, like you can probe a bit. You can, if you're starting to feel like, I'm not so sure what's going on here, explore it. Explore it with them. There's nothing wrong with doing that. There's nothing wrong with asking, like, okay, how have you been feeling recently? Like, tell me about your mood. Tell me about your energy. Tell me about, what's been going on. And just look for signs. Look for these red flags. Okay, so when we talk about, we always want to measure someone in comparison to themselves. So if you have a sense of what they're generally like, you want to look for changes in the norm, because there are red flags, but then there are things that are unique to a specific individual. Okay, so like, let's say, I'm a very introverted person. If I suddenly become really extroverted and I'm going out all the time, you might think, wow, like, that's great. But it also might be a bad sign. It might be a sign that this person is kind of deviating from their norm. So it might be a sign of distress. Okay, on its own, maybe not a big red flag, but you'll look for multiple red flags. So we'll talk about that too. Expressions of concern are when loved ones and family members and people who see them often start to say, I don't know, there's something off, there's something not so right, there's something, you're different, what's happening with you, I don't connect with you in the same way. You may not have access to that information because you may not be speaking to the people around them, but they might be telling you, I just don't connect with my friends anymore. I just don't connect with my mother's been giving me a really hard time because I just stopped calling her. Things like that. My wife, I just don't feel like I can relate to her anymore. That's an indirect expression of concern. Okay, detecting red flags. So, what are some of the red flags that you guys have identified so far? Yes.
One red flag that I see very easy to spot. It's mainly when your client is talking more about what they've been through, more than where they want to be or where they want to go next.
Right.
So I don't define it as a red flag, but it's definitely a sign that you should refer.
Okay. Yeah. Yeah, please.
Because it's very tricky for us, this part, when they keep talking about the past, you're not sure, are they attached or they just want to let you know where they're coming from. So,
yes. Yeah, that's a good point. Okay, yes. Repeating the same patterns. Okay, I can repeat it back. Patterns for sure. You see it over and over, especially if you're observing the person, you'll start to see that. That's a really good red flag. Stuck in the past, that's similar. Yeah, for sure. I also want to add kind of worrying a lot about the future. Because that was something that was said in one of the panels yesterday, that, in coaching, you're forward focused. So when someone is kind of talking about the past a lot, it's an obvious red flag to you. But something that's maybe a bit difficult is that, someone is actually having a lot of worry about the future, and they're thinking too much about the future. And if you're trying to teach them how to be present, and they're not being able to learn that, that might be a sign as well. Yeah, over-exaggeration, that's a cognitive trap. Anyway, we always think about like a person who thinks too much about the future, but that's like a simple way of thinking about it, that someone who's thinking too much about the future is dealing with anxiety, and someone who's thinking too much about the past is dealing with depression. It's not a cold, hard fact, but it's just, something that helps you remember. All right, detecting red flags. So a lot of you might be seeing professionals. So in the workplace context, you're looking at increased absences. They're always late. They're asking for accommodation. They're asking for doctor's notes or leave. They need kind of reassurance a lot. They're always sort of in contact. And especially, again, like if this is a deviation from baseline, so it's not something that they were doing, and then they start doing that a lot more, those are red flags. Those are signs that this person may not be doing so well. Okay? Any others in the workplace that you guys have noticed? Okay. This is the range of red flags. I'm gonna fly through these because I really want to get to the next part. But yeah, if this is going from the lightest, or the kind of like the flag is more greenish or yellow, you know, and then as you go down, it gets more red or more alarming, and there's 2 pages. So this is at the bottom of this page, you're midway through the range of red flags, okay? So we're talking about difference in motivation compared to the norm. This one, I kind of questioned whether or not I want to put this on here, because I think as coaches, most of the time you guys are working with motivation, right? So it's actually very much in your wheelhouse to deal with differences in motivation. But if you notice that, then I just want, you know, like 1 ping to go off. If you notice that there's a little, there's quite a big change in your motivation, 1 ping is going off. And then if you're starting to add other red flags to that, ping, 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 right? That's how we kind of want to think about this. That the lower pings, the lower flags, it doesn't mean you're rushing to therapy just yet. It just means that you're starting to be alert. You're starting to look for those signs. Feeling overwhelmed, we kind of already talked about that. The person just kind of looks stressed, they look worried, they look anxious, they're feeling anxious, they're expressing that a lot. There's sadness, there's irritability, there's outbursts, there's emotional liability. That's kind of similar to the relationship thing. It's something that, you know, there's a lot of emotional ups and downs that you see. That's maybe a sign you want to refer. Yes?
Can I ask a question?
Please.
Should this also be consistent and persistent? Because sometimes like it's an event that happens,
Yes.
and there's something that's going on.
Yeah.
So when we work on it in coaching, like he goes back to the norm.
Yeah.
So should it be as well consistent and persistent?
Yeah, consistent,
Okay.
persistent, causing difficulty it's causing a lot of distress, it's causing dysfunction, it's causing them to kind of feel like they're not really getting to where they want to be. And again, it's happening all the time. There's a pattern of it. That's what you want to be looking at. Social withdrawal, so they're getting smaller and smaller into their circle. Disorganized, so they're suddenly just like all over the place. They're not able to sleep, they're not able to think coherently, they're losing things, they're missing things, they're always late, stuff like that. Changes in appearance, or suddenly they're coming to their sessions and they're just sort of, again, like really unkept, really just not, you know, maybe they've lost a lot of weight, or they have like bags under their eyes, things like that. Again, changes from the baseline. This, you might, you know, when I used to teach this in universities, would always say like a lot of students kind of look disheveled, you know. So that's not a red flag on its own. But if they're a person who's polished, and then they've come to the next 2 to 3 sessions, and they're wearing, you know, sweatpants, and their hair is is oily and it's in a bun, and what, you know, what have you, they're not doing so well. There's a sign of something else. Now, denial of obvious problems. So denial, that's kind of a problem as well, especially if it's denial of something really big that's happened in their life. So again, earlier I talked about loss, and it's a loss, you know, the ambiguous loss. So I had a miscarriage. I'm fine. I'm totally fine. There's nothing wrong. That's harder to see, yeah, because that's that ambiguous loss. It's not something I ever really had, so how can I mourn it? But you can. Numerous unexplained physical ailments, so they're always kind of feeling sick, the stomach, the heart, all sorts of things like that. Our minds live in our bodies, so it will impact. Substance misuse, so they're suddenly drinking a lot more, they're suddenly smoking a lot more, they're suddenly, you know, partaking in their sort of recreational drugs a lot more, they're misusing their actual medication, and then we talked about suicidal ideation. Feelings of worthlessness, failure, feeling like a failure, catastrophic thinking, these are precursors or indicators of suicidal thoughts, okay? So if someone is kind of constantly bringing up this like, I'm so useless, I'm worthless, there's just no point, that nihilistic kind of mentality, ping, 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 yeah? So that's something, be on the safe side. Always err on the side of caution. If in doubt, refer. You don't have to, again, you don't have to let go of your client. It just means that you want to make sure that they're safe. And that's for their safety and for yours as well. I can't tell you the pain of losing a client. It hurts. So
Yeah, can I add one more
Yeah.
thing? It's also you refer and the client will work on this part with his therapist, but then he will come back to you again because he want to work on the future plan and what is he planning to do after he feels better and so and all of his dreams and targets and all of these things. So you never lose the client. You're actually doing this for his own good. So.
Yes, yeah, thank you. And it's also an important thing to realize that, often what happens is that you're not going to be as effective at your job if your client is dealing with these big things, and you will enjoy your job a lot more if their client has kind of handled that and they're coming back to you. And often, I always tell this to my clients, even I'll say, the reason you came to therapy, we're going to handle that at first, but then the real therapy will start afterwards. And that's where you're actually working towards like growth and kind of that light, or that, like I heard a lot of people talking about that yesterday, and that's something that I think coaching really comes into play there a lot, where often clients will come to you first, but really they need to go to therapy first, and then they can work with you. And you will find yourselves on the receiving end of the clients before they're actually ready for you. So it's often is a burden on you that you do have to say, okay, I need you to go to therapy, and then you can come back. And I just want to share also something, like, this is something that actually personally happened to me, where like I've been in therapy twice in my life. The second time as a therapist, this happened like recently. My physical coach, was also a life coach, told me, you need to go to therapy. And she was working with me a lot on changing some of my behaviors and things, and she was like, I will be able to help you a lot more if you're in therapy. And I was like, no. And then eventually I went, and I'm so glad that I did. And then she was able to really be a positive impact on my life because she wasn't dealing with these big things that I had to deal with a therapist. Yeah. Yeah. You can always apply things to yourself, but again, it's sometimes, if you're feeling stuck, you're feeling stagnant, you're feeling, that you need a different perspective, I always suggest to get help, right? At the end of the day, your therapist and your coach, whoever, can't fix you. You're always going to have to do the work. So if you have skills, if you have tools, you should apply them to yourself, but you shouldn't stay stuck in applying them to yourself, and that's, I think, kind of what made me sort of at that time be like, but I am a therapist. I can therapize myself. And often, even when I was in therapy, I did, like in between the sessions, I would continue the work, and my therapist would say like, oh, you're therapizing yourself in between the sessions, but I still needed to check in with her because I need support. So it's your client, the onus is on them to fix themselves. They're the only ones who can make themselves well. You are a supporter. And so if you have skills, you can definitely use them on yourself, but you need support. Does that make sense? Yeah, there's a question. Yeah. I think that it's really personal to you, depending on how you're feeling. So I'll tell you for myself, what I did was I actually just cut down. I did less therapy, but I didn't stop altogether. But I needed to cut down. So it really depends on you and what you need, right? So if you need a break, by all means take a break, you'll be more effective. You're like a saw, right? Like if your purpose is to cut wood, and then that saw goes flat, no matter how much you try to cut that wood, it's not going to cut. It's flat. It won't fulfill its purpose. You have to stop. You have to sharpen that saw, and then it will refill its purpose. So maybe therapy sometimes is like that. That makes sense. Okay. I just want to get through this, so I'll just kind of fly here. We talked about the pattern. So observe the pattern, frequency, urgency. I always tell my clients to observe two things when they're talking about things that they're experiencing, symptoms, signs and symptoms. The frequency and the intensity. All right? So how often is this happening and how intense is it? Is it something that is really difficult to ignore? Is it something that it's really difficult to kind of move on from? Do I stay stuck there? Then it's quite intense. Is it happening all the time? Do I experience this several times a day? It's quite frequent. That's problematic. That's when you want to think about that, okay? Then we talked about the combination of things. So there's more than one red flag that you're seeing at a time. Yeah? Yes. I need to get better now. I need to do this now. Yeah. Yeah. How long is this going to take? How often do we hear that? Yeah. Yeah. And then my response is always, we can't rush something that we want to last a lifetime. Yeah. It took you your entire life to develop this. So let's give it a little bit of time. Yeah. 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 There's always that. There's always that. Yeah. All right. If in doubt, you can always use screening tools. So these are some screening tools that you can use for overall wellness. If you type in 7 dimensions of well-being screening tool, there is a questionnaire, it's validated, you can use that tells you kind of about their overall wellness. There's a burnout inventory. Just a quick tidbit about burnout, because I think probably in your career, you guys see a lot of people with burnout. Burnout is vocational, which means that it's related to work. So if the person takes a long vacation from work and they feel better and all of their symptoms go away, that's burnout. If they take that break and the symptoms are still there, that's depression, that's anxiety, refer out, okay? Yes, these are self-report. I would always check. You can give it to them. They can fill it out in the office with you. But if it's a self-report measure, then they need to do it themselves. Okay? You don't need to be too picky about it, but because you're not doing research with it. Sometimes I will read it to a client, but if it's a self-report, generally you just give it to them. They can fill it out. You can send it to them in advance. There's PDF versions. There's online versions. GAF is a global assessment of functioning. And then there's a mental health continuum questionnaire that gives you an overall sense. There's also disorder-specific screening tools. So if you're unsure if this person is experiencing a specific disorder, you can do the screening tool. Screening tools tell you if a person is likely to have this diagnosis, okay? So I gave that example here of the MDQ, which is a mood disorders questionnaire. It's a 13-item questionnaire. If this client scores 7 or above, it means that they probably have bipolar disorder. It doesn't mean that they have it. It just means that they probably have it and they need to be checked by a professional. So this is a really great way because they're validated tools. You can just give it to your client. If they score above a certain cutoff score, refer. Just, that helps. Yeah. You can search them online. You can also email me and I can send, or go see a professional for diagnosing. A continuous scoring means that there isn't a specific line after which you have to send someone. So you have to practice, use your own judgment. If someone's on the cusp, explore that with them. Say, okay, like you're coming off here as like kind of in the middle, you're sort of moderate. How do you feel about this? What do you think? What do you think about where you stand? Do you feel like this is a problem for you? What do you want to do? What are your options? Would you like us to go through some of your options together? This is kind of some of the ways that you can sort of get through this. All right, and if in doubt, ask. So you can ask your client, you can talk to your client, but you can also ask a mental health professional. You can ask, so like you can reach out to us at 07. We have a team of frontline psychologists who answer all of these types of questions. You can say, I have a client who's going through XYZ, what do you think? And then if they're not sure, they'll come back to the medical team, and then the medical team will say, okay, yeah, actually, no, that's okay, you can continue, or this is 1 ping, 2 pings, or it's like, no, this is 3 pings, refer out, and they can let you know who they might need to go to. Okay? I'm almost out of time. I really didn't space myself properly. All right, how do I refer? Misconceptions about referring. We talked about this. You're letting go of your client. No, you're not. We already talked about this quite a bit, so I won't get into it too much detail. The second thing, you might feel like you have failed. You really haven't. You really haven't. If you're choosing to refer your client, you've far from failed. You've succeeded, you know, and if they're following you through that, that's something quite beautiful. And I think often, we have to deal with our own feelings about referral, and a lot of things do come up. It's really tough. It's hard. It feels like you have failed, or you feel like, I wish I did better. I wish I could be everything for this person. And we forget that, like I said in the beginning, you're not going to be everything to anybody. And when you do that, and you also don't know how you impact people. So sometimes I'll have clients who will reach out to me and say, like, you really helped me through this. And I'll be like, what? Really? That was what was helpful to you? So the fact that you refer them, you never know. Like, they might come back to you and be like, you saved my life. When you did that, you changed my life. So discussing it with people. All right, how to refer. So the first thing, explore ambivalence. So ambivalence is kind of this feeling of like, I'm uncertain, I don't really want to do this, I just, also maybe like not caring or not being really engaged with this discussion. And what I mean by explore it is ask questions about it. Open-ended questions, Socratic method. What would be good about going to therapy? What would be bad about going to therapy? What would be something that could change? What is something that you're afraid of? What about doing it later? Is it something that you'd feel you might be ready for later in life, at some point? Just ask these questions. The answer could be no, not today, but you are priming them to be ready, to be open, not just to the idea of therapy, but to anything. And I also wanted to say this earlier, when I'm talking about, I'm really focused today on referring to therapy, but this is referral in general, anywhere across the mental health spectrum, right? Like, you might be referring them to exercise and they're really ambivalent. Explore the ambivalence. What would be good about going to the gym? What would be bad about it? And then there's a technique in, has anyone heard of motivational interviewing? Okay, so how it works in motivational interviewing, you ask the client, what would be some of the good things about going to therapy? And they'd say, well, maybe I would be able to figure out why I have this kind of relationship with my mom, and that might be nice. Okay, and what might be some of the not so good things about going to therapy? And they would say, well, I think that it would be hard. And then you'd say, okay, so on one hand, going to therapy would be hard, but on the other hand, you might be able to work through some of these challenges that you have in your relationship with your mom, and you might be able to move on from there. And do you see how that worked? Where you ask them about the good things, you ask them about the not so good things, and then you repeat them back to them in a paraphrased way. You start with the not so good, and then you end with the good. Okay? So you're drawing this contradiction between what I want and what's kind of in the way. Okay? So share what you see. This is not diagnosing. Yesterday at the dinner, there was like a bit of conversation that I had with someone about referring, and this idea that maybe when I'm referring, it's like I'm diagnosing. It's like I'm saying you have a problem, and I'm telling you what this problem is. It's not quite the same, So you can be working with your client and say, I can see that you have been really struggling. I can see that you have been feeling very down recently. I can see that you have been having these challenges. You're not able to connect with people that you really care about. I can see that you've been feeling racked with guilt, and you're just repeating back to them what you see. That's not diagnosing. That's holding a mirror to them and letting them hear something that they know, but they don't really know. We're almost done. Okay, so I'm really sorry that I'm taking so much time. They're going to be bringing in your appetizers, so you can you can eat a bit. Okay, thank you. All right, so yeah, sharing what you see. This again creates this idea of, maybe I'm not doing as well as I thought I was. Yeah, it's not diagnosing. I remember for myself the first time someone told me, maybe you should talk to someone. I was actually really going through a very hard time, and when they said that, I was so relieved. I was like, oh, thank God. I was just waiting for someone to tell me, I just needed that. So that's sometimes the case where you just need to, like I said, like hold a mirror up to someone and help them see that, hey, you're dealing with some stuff that's pretty heavy and you don't have to deal with that. You don't have to continue to deal with that, because it's really easy for us to say, but so many people have it worse. Yeah, I've been feeling guilty, but who doesn't feel guilty? I've been feeling sad, but who isn't sad? We've just gone through a pandemic. Everyone's anxious. Yes, yeah. Yes. Yeah. Exactly.
Oh.
Yeah. So there's this. Okay. Sorry. Yeah. So you can. So the comment was, when you're working in coaching, there's this relationship of trust that you've built with your client, and they generally won't take it personally when you say those things. And something also that might happen where they say, I don't think that I've been feeling that way. And that's not a bad thing. This is a gift. We can explore that. Okay. That's, so that to me, it looks like you've been really sad, and you don't see, like, what you don't feel that way. What do you feel? How do you find, like, so it starts that dialogue. Yeah. And often, it might be so obvious, right? Like, I remember, again, so in my therapy, my therapist told me, when you sit in front of me, I see a person who's sad. And I've sometimes, like, when I'm in session with a client, and I see that, and it's so obvious to me, but then to them, it's like, is that really what you see? Because there's all these other areas of their life where maybe they're functioning, and they're okay. They're not that sad, but I can still laugh with my friends. Yeah, but I see you and you look sad. And then there's this disconnect between how I see myself and how someone else sees me. And that's like a really good thing to, yeah. Yeah, that's the denial. Yeah. All right. Don't be discouraged to bring up the topic more than once. So just because you brought it up once and they said, no, I don't want to talk about this, I don't want to be referred, I don't want to go to therapy, that doesn't mean that you have to cut it off. And by the way, guys, everything that I'm talking about, you can apply this to people in your life who aren't your clients. Your son, your spouse, your mother, your friend. These are things that you can apply with anyone. So don't be discouraged to bring it up more than once. Don't bring it up every time you see them. Okay, don't do that. That will be annoying fast. But just because you brought it up once doesn't mean that khalas, topic closed. End of discussion, we're never going to bring this up again. You can always bring it up again. And maybe the first time when you brought it up, their reaction was preliminary, and it was just like kind of a, what are you saying? No, I don't need this. But then after some time, they're like, oh, maybe I do need that. And maybe the fact that I reacted so harshly the first time is kind of what's preventing me from right now from saying, okay, yeah, I could try this again. So bring it up again. And so sometimes you can say, I know we've discussed this before, but I just want to get I want to maybe ask you again, how do you feel about this? Is this something that you might be a bit more open to? So on a scale of 1 to 10, how open are you? That's another way that you can kind of gauge where they're at. All right, offer to help them find a therapist on their terms. This is a big thing, right? So, definitely, like we mentioned, like at 07, you can reach out, we can help you figure out the right therapist for your client. But also, it's really good to do this with them. So you can say, what if we called them and we had this conversation with them together? Or what if you called them and then you and I discuss it afterwards? You can ask them for a few options. We'll get 2 or 3 therapist options, and then you guys we can discuss together. I can help you pick. How about that? Yeah. Yes. Yeah. Yeah, exactly. So you can even discuss, okay, so there's so many different types of therapists, there's so many different types of therapy. What do you think you might want? Do you want someone who's going to be more directive? Do you want a female? Do you want a male? Do you want someone who's going to listen? Do you want someone your age? Have this conversation with them. Make them a part of the process. It's not on you to decide who's the perfect therapist for your client. Have this discussion with them. Do it together. Bring up some options. You know, I think that can really make a difference. Okay, finally, don't make any promises. This is so important, especially if you're having a client who's maybe expressing suicidal thoughts or who's been kind of going through a really difficult time. Don't make any promises. Don't say, I promise I'll never bring this up. Don't promise that you will, you know, continue to be there for them forever. Don't promise that you won't have to call their loved one, you know, or their like emergency contact. Don't make those promises. And if they ask you to, you can always say, this is not something that I can fully promise, but what I can promise is that if I do X, Y, Z, I will let you know in advance. Or if I do that, like let's talk about the situations in which I can do that, or that you will allow me to do that. Does that make sense? Of course, I'm kind of being a bit generic, but it really might depend on the situation. So just the idea of promising in general can be really something you might want to avoid as much as you can. All right, and then final thing, make sure the timing and the setting is right. So just something to keep in mind, it really does make a difference where you're at, how the person is feeling. So if they're coming in and they're in a state, they're really, really low, but they're just not ready to kind of talk about this on that day, or they're very tired, or they're, you know, it might actually be the perfect time, or it might be the worst time. So kind of be thoughtful about that. It might be trial and error. So you may have thought it was the right time and it wasn't. Don't beat yourself up. You can always retract. You can always say, you know what, maybe I shouldn't have brought this up right now. Let's close that topic, but if you don't mind, can we talk about it next session? That could be a way to handle that. Okay? All right. I have 2 more slides, and then I'm going to let you eat in peace. Okay. So express empathy by active and reflective listening. So these are the principles of active listening. I think that you guys you're taught active listening, but it's always nice to have a little reminder. Active listening is so important. It's so important. Like most of what we do is active listening. So yeah, ask open-ended questions, point out their strengths, which actually isn't one of the principles of active listening, but I just wanted to throw that in there. Always point out people's strengths. Don't, you know, so earlier I talked about like kind of tell them what you observe, share what you observe, tell them I see that X, Y, Z, but also put that in terms of what when you give them feedback, do that in the form of, this is what you're really good at. Like I see that you're so creative and you're really great at problem solving, and right now, because you've been feeling this way, it's been really hard for you to tap into that. And that might be, you know, something that might move them. You never know, right? But in general, positive-based feedback is always, always better than anything kind of criticism-based. It will always yield better outcomes. Criticism always yields negative outcomes. So, and there's like a lot of research that shows that, and I'd be happy to share it if anyone wants to see. But yeah, so point out their strengths, make affirmations, you know, affirmations kind of like, what you're going through is really difficult. This time that you've been passing through is really hard. I am here for you. I will be here for you. I'm not leaving you. I'm following through with you. I'm always gonna be a support for you. And yeah, so when we talk about like open, I think with active listening, it's a lot about the body language, the ums and the ahs, and then rephrasing, paraphrasing, and summarizing. So when people, and that's what we did with the like little piece of motivational interviewing that I taught earlier, of like rephrasing the thing back to them. So when people tell you something, repeat it back to them so they can hear it. It's that same idea of holding a mirror up to them. Okay?
Tamara,
yes.
عايزة أقول لك حاجة مهمة قوي.
Okay.
This is one of our main competencies برضه.
Yeah, okay, great. Yeah, these are core to active listening. So anyone who's yeah, if you're a coach, you're a supporter, you are a peer supporter, even it's good to practice this. Even just being a friend, like you're a better friend if you do these things, right? All right. Develop and point out discrepancies between their goals, which is something that you guys work on a lot. So these are your goals, and then this is what you're doing.
Yeah.
And always kind of pointing out these discrepancies and highlighting them in ways. So I hear that you're saying that you want to do X, Y, Z, but this is what you're doing.
I am so happy you're mentioning this because like now we see where we stand and where you stand. So it's very nice that you actually added what we do within the...
Awesome. Great. Yeah. And then we put that in the context of referring in particular, right? So this is what you're doing in general when you're working with your clients. When you're doing that in the context of referring, again, you might be bringing up like the example I gave earlier of like you really want to have better relationships, or you really want to achieve your potential, but most of the time it's really hard for you to achieve your potential because you're feeling kind of guilty, or you're feeling you're sort of stuck in the past. And so there again, you're drawing this contradiction, okay? And also, by the way, these are also principles of motivational interviewing. Yeah. So yes, yeah. There's a lot of overlap, right? Because as coaches, you work a lot with people on their motivation, and motivational interviewing is about creating change in people's habits and in people's behaviors. There's really great courses on motivational interviewing, and what I'm teaching you are basics of also like brief interventions where you're doing this in like a short period. So it's actually something that actually like I learned this in an ER. So I learned this in terms of like when someone comes into an ER, how do you do this in a quick way? So it's really something that you can do quite easily. Or well, I mean, it takes time to learn the skill, but I mean, it doesn't take time to do it when you get the hang of it. And at first, it feels very awkward. I just want to say, anyone who's practiced like active listening or motivational interviewing, and I'm seeing some nods. Like the first time you try it, it's like feels very unnatural, and that's okay. It feels unnatural to you, not to them. And then over time, it becomes a lot easier. And I suggest you practice it with each other, right? So maybe as you're having your lunch today, just kind of take a moment and actually practice it with each other. It's really, really great. All right. Avoid arguing or confrontation. I think that kind of goes without saying. So the point here, though, that again, this is a collaboration. This is a process. You're not trying to refer in one sitting. You're referring over multiple sittings. And you want this to be kind of like a joint decision where it's the client's choice and they're making that choice and you're facilitating them making that choice. Okay? And then support their autonomy. So always say, at the end of the day, whatever you choose to do is what you choose to do. And I'm going to support you. But how can I help you make this decision? Yeah, supporting their, so it's about accountability, ownership over one's life, but also that it's autonomy isn't just, it's about feeling like I can make a choice. And that's really important. It's really important to someone's overall well-being to feel like I can make a choice. All right. I'm going to summarize and I'm going to let you guys go. Thank you so much for all the time that you've given me. Thanks. So a quick summary, right? So recognize your feelings about referral. They may be negative, they may be mixed. That's also really common. You might feel relieved that you're no longer dealing with this client because it's been really, really hard on you. And you also might really feel sad about it. And that's totally okay, yeah? So if you feel relief, you don't need to feel guilty about that. It's okay. Familiarize yourself with the spectrum of interventions. Remember that it's a process, and if in doubt, just ask. You have resources. O7 is a resource for you. Reach out, we will help you. And yeah, that's it. Thank you so much. Please enjoy your dinner. Thank you.